This 51-year-old patient was referred to me for endodontic treatment of this heavily restored tooth number 3. Tooth has a temporary crown on it, and patient had pain associated with the tooth. We examined the tooth, tender to percussion palpation, probings 2 to 3 millimeters all around, and this tooth, as you can see, there's a periapical lucency associated with it, so it's a necrotic tooth. Heavily restored, as you can see, tons of composite buildup underneath this temporary crown. It was so much so that when I was looking for the palatal canal, this dentist had actually put composite over the orifice of the palatal canal and into the palatal canal. So of course I used a surgical operating microscope, and I had to trough and remove composite from the approximate location, the location of the orifice of the palatal canal, and then I was able to finally hit it. I had to remove a lot of composite because, again, this dentist had put composite over the palatal canal orifice and into it. So these are the things that you need to be prepared for, unforeseen challenges. Okay, so partially calcified canals too, as you can see. So take a look. Here's one angulation. Look at that anatomy there. Beautiful anatomy there. Look at the S-shaped curvature of the distal buccal canal. Now, you want me to wow you? Look at this angulation. That's my MB2 off of the MB1 canal. Look at that. Beautiful. 3-dimensional instrumentation, irrigation, and obturation. I don't have any expensive and fancy equipment like gentle wave and lasers, and none of that stuff. I don't have any of that stuff. I irrigate with 6% sodium hypochlorite in a syringe with, of course, irrigation needle, and then sonic activation. And finally, warm vertical obturation technique using gutta percha and AH+ sealer. And this is the result. You can accomplish great results like this 3-dimensional endodontic treatment. 3-dimensional endodontic treatment, which means 3-dimensional instrumentation, irrigation, activation, and obturation, with just simple equipment, not fancy, simple equipment that you can instrument and equipment that you can find anywhere in any country. You don't need $100,000 machine to irrigate for you. You don't need a $60,000 laser machine to use laser for whatever reason. You don't need any of that stuff. You can accomplish results like this with just simple instruments and equipments.